Hello again. Now, the Gauteng Health Department is planning to vaccinate at least 95% of children against measles. It says it's concerned that the disease might spread in schools. This comes amid a rapid spread of measles infections across the country since late last year. Nomantu Nkomo-Ralehoko is Gauteng Health MEC. She joins us now to give us an update about the province's efforts in terms of vaccinating against measles. MEC, good afternoon. Welcome to today, and thank you very much for your time. Your target is very high. What's the progress currently?
It's very high, Putwami, because we've realized that we have a number of schools and young people that need to be vaccinated. And the response, it's quite good because we have started to do this vaccination campaign for measles this week. And already we've been moving around the facilities from Monday to Friday. And we're sitting now we started on the 13th of January. And already more than 141, 456 children that have been immunized to protect them against the measles. So already you can see we've vaccinated a big number, and we're targeting the children from 6 months to 15 years. And today I was in Shawela. The response was quite good. Yesterday I was in Soshanguve. Same, the response was very good. So you can see that this campaign is going to go because our target indeed is to immunize 4 million eligible children between the ages that I've just indicated, because measles is quite one of the dangerous diseases that we must deal with. What has made us to do that is because already in our province, 15 confirmed that they've been having measles. And we had 8 from Ekurhuleni district and 2 from Johannesburg, 4 from Tshwane, and 1 case is in West Rand. It's only in Sidibeng where we don't have a case. So we don't want it to spread. We want to control it. Hence, we're targeting these young people and ensure that we respond as a province.
Are you going to use the start of the new academic year through school? Because, I mean, we know that children are very susceptible to getting measles, especially between the ages of 5 and 8, and they're the school-going age. That is when many of them should be immunized. Are you going to be using the schooling system?
Yes, we're doing that. We're working with the Department of Education. We have an integrated health program that we're doing, that we've been using it even during COVID-19. So it becomes very easy for us because both departments are there at school.
Yeah. So the concern would be there's an outbreak. It means young people have not been vaccinated. Maybe many parents have not immunized them during birth, and then maybe later now as they start school. Are you going to go on a bigger campaign on a consistent basis?
We are going on a bigger campaign on a consistent basis. As we speak, you can see that I'm doing the interview in a car. I'm in Meadowlands because we are here talking about the do's and don'ts, the importance of them, making sure that they take boosters as elders, but including young people. Because again, as the department now, we are localizing our health system. We don't want to only say go to hospital or go to the clinic. I go out with my team. We're doing road shows in the whole province in ensuring that we have a campaign about all these diseases that are common, that can create things that can be uncontrollable. One of those, because we know that even we want to stop this measles before it can go to a higher number, because we're targeting even those that have high fever. We're telling them that if you are coughing, you must know that there's something wrong with you. If you have running nose or you are sneezing and we have red or watery eyes or a sore throat, those are the signs that you are not well. So we need to make sure that we stop that. So that's the reason that we need to prevent it before it's getting more.
You say you are on the ground in Soweto, and you've you're at one particular area in Meadowlands. How has the response been from the various communities you've been visiting today as you make them aware of the importance of vaccinating against measles?
The response is quite good. In fact, I was shocked when I was at Shawela, including Soshanguve yesterday, when I see the number of children where parents have signed those consent forms, because you can see in the guidance, you can see when you don't get that response that people are not active on that. But all of them, they are signing those forms. They are saying to me, go all out and make sure that you even. In fact, the other one was saying to me, I must even have a booklet that I circulate when I go around, because I was saying to them, no, I talk to you, but we talk to social media, working with, or even the media like yourselves, or bringing yourselves in so that you can help us to preach the gospel. But they were saying, we even need booklets that must be written in our language so that you can leave us with those and tell us the do's and don'ts and other diseases that we can come across if we are not vaccinating, including the boosters. I'm encouraging them to take boosters, some of them, and they are doing that because we have the whole entourage from the department that is assisting us on those specific things that we should be doing.
Yeah. Just the state of the measles outbreak in terms of numbers, you mentioned like 12 cases. Are those the only ones that have been reported, MEC?
Is the 15 that we have, not even 12. You can see it's a bit high. We have 15. It has been reported, we've discovered it, and in Ekurhuleni, but we're treating them already. I've said in Ekurhuleni and Johannesburg, we had 4 in Johannesburg. Ekurhuleni, we have 2, and we in fact we're trying to stop in other districts like Sedibeng where you don't have any.
Okay.
So we're happy that still at least a region that we don't have any case of measles.
Okay, finally, give us that number, that total number you're targeting to vaccinate against measles. So how many children do you hope to vaccinate in the next few weeks? What's your target?
Our target, we want to make sure that at least we're above 95,000 children. Yeah.